Well, many Nigerians are believed to be managing one form of trauma or the other in their daily lives. But what interventions are available to help them heal? Senior correspondent Ivy Kano brings us this report.
Research shows that trauma manifests in different forms, affecting not just physical well-being, but also neurological, emotional, social, biological, and psychological health. Acute trauma results from a single incident. Chronic trauma stems from repeated and prolonged exposure. Complex trauma involves exposure to varied and multiple traumatic events over time. Nigeria does not have an official record of trauma centers, raising concerns about access to specialized care. Intergenerational trauma passed from one generation to the next is another pressing issue. A recent conference in Lagos seeks to address this by advocating for strategies to prevent trauma transmission. 16 Bible Society across Africa, alongside representatives from the American Bible Society, convened in Lagos to discuss trauma healing. The event brought together mental health professionals, religious leaders, and community workers. Experts at the event emphasized the importance of fostering resilience at both individual and community levels.
Majority of people are sick, and you see it in their speech, in their policy, in their attitude. And that was why some years back in psychiatry, we said people that go to politics, is it not right for them to have mental assessment?
It's very important to identify what triggers trauma. Then the next one is avoid the triggers. The second strategy is curative strategies.
They've all agreed that it is important for collaboration between non-governmental organizations in order to drive this idea. Panel discussions were interactive, with professionals calling for worship centers to differentiate between general counseling and trauma-focused care.
Get the church to see the necessity to have trained personnel and not just play religion, the old religion with the situation. The situation we have all over the world now is so precarious, so serious.
There are so many times when you counsel people in the church, because you, the counselor yourself, you lack some basic knowledge of how trauma exists, what does it take to be traumatized, and how to heal such wound. So your counseling is limited.
Here in Nigeria, we have people who have been trained and they have different certification level, a master facilitator. So those are the people that are qualified to provide certification. It's done at local level all over the world.
Mrs. Gloria Omomo knows this pain firsthand. Her 13-year-old son has been missing since the 11th of February 2025. Through tears, she shares her distress, saying no parent should ever endure such traumatic experience.
I stopped over at the mini-mart to get some cash from my sales girl. When I got back to the car, he wasn't in the car again. So I now called my sales guy. I said, come, where is John? She now said that he was pressed. He wants to pull, so he's inside the shop. That was how we started looking for him till date. We've reported to all the police stations around us, about 6 police stations. It's a bit challenging. It's a Down syndrome, though he might not want to talk to a stranger because he has never for once entered the public transport before. Ms. Omomo, along with her family and loved ones, needs all the support as they navigate this agonizing period. Her case is just one of many, highlighting the urgent need for more trauma management and treatment centers. Ivy Kano, TVC News, Lagos.
In other